Destiny. I'm a student nurse at Orbis. Today I will be doing a GI and musculoskeletal assessment on you today, okay? Do you mind putting out your wristband and telling me your name and your date of birth?
Ricardo Moreno, November 11th, 1995.
Okay, thank you very much. Do you have any allergies?
No.
Okay, so we have a 24-year-old male sitting upright, no signs of discomfort or pain, no abdominal guarding, appears to be alert and oriented. Muscle development appears to be symmetrical bilaterally and appears to not have any nutritional deficiencies. All right, so just so you know, the assessment does involve some inspecting, some touching, and as well as testing your muscle strength. Is that okay? Okay, so I have a few questions for you before we start. Have you had any abdominal or urinary surgeries?
No.
Okay. Have you had any urinary issues?
No.
Okay. Any medical history with any GI diseases? What about family medical history?
No.
Okay, good. Have you been feeling any nausea, vomiting? Have you had vomiting or diarrhea?
No.
Okay, good. Now I'm going to ask about some musculoskeletal things for you, okay? Do you have to lift heavy weight at work?
No.
Okay. Any bone fractures?
No.
Okay. Have you been feeling any strains or sprains with your muscles? Have you had any of those?
No.
Okay. So tell me, have you had any joint, bone, or muscle surgery?
No.
Okay. And no joint and bone diseases?
No.
Okay. What about family medical history?
No.
Okay. All right, good. So that concludes my questioning. I'm going to begin the assessment. If you feel any pain at any point, tell me, okay?
Okay.
All right. Do you mind laying down for me, please?
Sure.
Okay. So I'm first going to inspect the abdomen. No hernias noted, no scarring, no abrasions. I see that the abdomen is slightly rounded, which is normal. I also see no obvious veins and no pulsations as well. Okay, good. Now I am going to listen for your bowel sounds, okay? Good. So bowel sounds are normal active, which is a good thing. Okay, so now I am going to listen for bruits, okay? First going to do your abdominal aortic. Okay, now I'm going to do renal. Now I'm going to do iliac. Good, no bruits noted. Okay, so now I am going to percuss, okay? Good. Okay, so I heard dullness and tympanic sounds in the areas expected. Alright, so now I am going to do some palpations, okay? Going to start with light palpations and then deep palpations. If you feel pain, let me know.
Okay.
Any pain?
No.
Okay, gonna do deep. Pain?
No.
Okay, good. So patient reported no pain during the palpations. I also note no masses or tenderness during the palpation either. Okay, good. So now I am going to have you get up, please. We'll just turn around for me. Okay. Now I'm going to check for costovertebral angle tenderness, okay? So can you raise both of your arms up for me? If you feel pain, let me know.
Okay.
Any pain?
Nope.
Any pain?
Nope.
Okay, good. All right, so no costovertebral angle tenderness, which is good. If he were to have it, that means he could possibly have pyelonephritis. All right, so now I am going to start the second half of the assessment with musculoskeletal. I'm going to inspect the back. I see that the vertebral process is midline, so no scoliosis noted. I'm going to palpate the paravertebral muscles. Any pain?
No.
Okay, good. All right, so now I'm gonna have you get up, please. All right, so I'm gonna just look back here. So can you first do a flexion like this for me? Good. Okay, now can you extend this way for me? Okay, now can you do side to side for me? Good. Now can you do rotations like this for me? Good, good. All right, so like I said before, no scoliosis noted. Okay, and now I am going to have you sit back down for me, please. Okay, so do you mind having your arms out for me? I'm going to first inspect. Okay, so I see that your scapulae are symmetrical bilaterally. Your shoulder height is also symmetrical bilaterally. I am now going to say that your upper extremities appear to be symmetrical bilaterally, along with your shoulder, your wrists, and your elbows are aligned, so that's good. Okay, so now I'm going to palpate, okay? Any pain?
No.
Okay. Checking for edema. No edema, and your muscle tone appeared to be symmetrical bilaterally as well. Gonna check for temperature. Okay. Skin is dry and warm to the touch. All right, so you are free to put them down. All right, so now you can get up. We're gonna do a couple of ranges of motions, okay? All right, so can you can you flex? Now can you extend for me? Okay, now can you abduct? And then abduct. Good. Now can you have your arms close to the side? Can you externally rotate, internally rotate? Good. Now we're gonna do elbows. Can you flex for me? Can you extend for me? Thank you. Now for your wrists, can you flex? And then can you extend? Good. All right. Now can you abduct your fingers? Okay. Now can you ball them up in a fist for abduction? Good, good. Okay, so now we're going to test your muscle strength, okay? All right, so can you put these out for me again? Go against the pressure, okay? Good. Can you have your arms out like this again? Good. Okay, so can you flex your elbows again for me? Good job. All right, and so now can you flex your wrist for me again? Go against that pressure. Okay, now can you extend? Okay, good job. Now, can you have your fingers out for me as far apart as you can? Don't have me be able to have your fingers touch, okay? Okay, good job. Now, can you hold on to my hand as hard as you can? Thank you. So I'm going to give your shoulders, your elbows, and your wrists and hands a 5 out of 5. Really good, okay? Okay, so now I'm gonna have you sit back down for me. So we're going to inspect your lower extremities. I see that your hips, your knees, and your ankles are aligned. Your lower extremities appear to be symmetrical bilaterally. I'm now going to palpate. Any pain?
No.
Okay. No tenderness noted. Muscle tone appears to be symmetrical bilaterally. Gonna check for edema. Okay. Edema is not noted, so no edema. And I'm going to check temperature. Okay. So skin is dry and warm to the touch. Okay, good. So can you stand back up for me, please? We're going to do a couple ranges of motions, okay? So can you first flex your hip? Okay, and then extend. Can you do the same thing for the other leg? Good. All right, so now can you abduct your leg and then adduct? And your other leg, please. Good. Okay. Now, can you do an external rotation, then an internal rotation? And your other leg, please. Good. All right, now we're gonna do the knees, okay? So can you extend your knee and then flex your knee and your other leg do that as well, please? Good job. Okay, so now for the ankles, can you externally rotate and then internally rotate both ankles? Good. Now can you do a dorsiflexion? Good. And now can you do a plantar flexion? Good job. All right. So now we're going to test your muscle strength, okay? All right. So can you flex your hip for me again? Go against the pressure, okay? Other leg? Okay. Can you abduct your leg? Okay. And other leg? Good. Now we're going to do knees. For this one, you can sit down if you like. Okay. Do you mind extending your leg out for me? Go against that pressure. Other leg? Good. All right, so now we're going to do your feet. Can you do a dorsiflexion? So how it was up like that? Good. Good, okay. So I'm going to give your hips, your knees, and your ankles a 5 out of 5 as well. So that concludes my assessment. Do you have any questions for me?
No, no questions.
Okay, thank you.